Hello, my name is Julia Smoliak, and I will be presenting my research on the effects of nutritional intervention on placental ability to regulate inflammation. So, to begin with, placenta is an organ that provides oxygen and nutrients to growing babies, and it also eliminates the waste products in the blood, and therefore it's a very vital structure for the healthy growth and development of offspring. And during pregnancy, inflammation is very tightly regulated, and the disruption of the delicate balance of cytokines at the maternal interface caused by infection can increase the risk of pregnancy outcomes that are adverse. And we already know that dietary factors may be able to regulate oxidative stress responses and reduce placental inflammation. So we tested specific biochemical targets for the nutritional intervention. So one dietary factor that we tested was sulforaphane, and sulforaphane is a sulfur-rich compound found in many vegetables, and it is also found in over-the-counter nutritional supplements. So we chose sulforaphane because sulforaphane is known to increase HO1, and HO1 is having a lack of it is known to cause several health problems, such as pregnancy disorders, such as miscarriages and preeclampsia. And there have been studies done with HO1 knockout mice having high rates of fetal wastage and extensive placental inflammation. We also tested melatonin, and melatonin is derived from an amino acid that is required for the normal growth of infants. And it is known to have many benefits such as anti-inflammatory effects, antioxidant and immunoregulatory effects. And it's also known to have other health benefits such as reducing obesity and other health problems. And however, when specifically looking at melatonin's immunological effect on the placenta, there is limited knowledge and research done. Therefore, we tested these two dietary factors on and measured their effects on placental ability to regulate oxidative stress responses and inflammation. And we also tested for both their effects on BDNF, the neurodevelopment marker, and we did this both in the presence and absence of E. coli, which represents infection of bacteria. We also tested for all of these biomarkers, but most importantly, we tested for HO1. All of these biomarkers essentially indicate adverse pregnancy outcomes. So to begin with, we started with 12 different women undergoing elective C-sections. This was to ensure that this wasn't it wasn't traumatic for the placenta, and as opposed to an emergency C-section. And we cleansed it with PBS. We separated it into segments, and we chopped it, and then plated it into a 12-well plate and kept it in culture medium. After the placenta was washed and plated, we took E. coli and put it into log phase, and then it was also ensured that it was killed after placing it at 75 degrees Celsius for an hour. And then we placed various concentrations of E. coli with either sulforaphane or melatonin. And then DMSO was added so that the final concentration was 0.25%. And then the tissues were incubated, and then the conditioned medium was harvested and stored. Next, the potential effects of sulforaphane on the viability of cultured tissues was measured using MTT, which basically measured for any essential toxicity of the concentrations. And the conditioned medium was removed, the tissues were washed with PBS, and then everything was centrifuged, and in soluble form formazozan was extracted with isopropanol. And then the absorbance using a microplate spectrophotometer was measured. Then after 24 hours, I was able to quantify the biomarkers using ELISA, quantified these biomarkers, and then using the R statistical programming language, I used a linear effects model to find the log transformed biomarkers concentration in a conditioned medium. So all the results are going to be shown in these graphs. So a key shows that the control for each placenta are the small open circles, and the mean difference from the control, the large filled circles, with 95% confidence intervals for each level of bacterial stimulation. And then the treatments with error bars crossing the dotted line, as shown here, and the points with bars crossing dotted line are not statistically different from the control, so they're not statistically significant. So to begin with, sulforaphane significantly enhanced HO1 production in a dose-dependent manner at 2.5 to 10 micrometers, as seen here. In the absence but not presence of infection, sulforaphane increased the antioxidant HO1 production, as can be seen here. And then it had no effect on the IL-1 beta production in the presence of E. coli. However, it significantly reduced the IL-1 beta production by cultures with E. coli in a dose-dependent manner, 5 to 10 micrometers. And then sulforaphane prevented the production of IL-beta and IL-10, as seen here, but tended to promote TNF-alpha production by cultures with E. coli. And then IL-6 and BDNF were inhibited by sulforaphane, not taking into account co-treatment with E. coli. And then a negative regulator of IL-6 signaling SGP-130 was increased by sulforaphane under basal conditions, but not in E. coli stimulated cultures. And these results suggest that sulforaphane had varied effects on the placenta, inhibiting both anti-inflammatory IL-10 and pro-inflammatory IL-1 beta factors, but promoting regulators of oxidative stress and inflammation, the HO1 and SGP-130, in an infection-dependent manner. And melatonin enhanced HO1 production, as seen here, as it tended to reduce the IL-1 beta production, and it enhanced IL-6 production and the IL-10 production, as can be seen here. And melatonin had little to no effect on SGP-130, but it tended to reduce the BDNF production, as seen here. So what can we gather? It's that HO1 prevents oxidative stress-induced inflammation, and it can be very important to ensure a normal pregnancy. And as we have seen, that it limits the consequences of infection on pregnancy outcomes. So we saw that sulforaphane was not inherently toxic, as proven by the MTT assay. It had no effect on the viability of placental cultures. And therefore, since sulforaphane and melatonin both enhance HO1 production, they may be very good candidate drugs to regulate adverse pregnancy outcomes. However, these responses were conditional, as some of the results were mixed. We have seen, based on the presence of E. coli, since no enhancement of HO1 production by sulforaphane in a bacteria-stimulated culture was observed. So therefore, further work will be needed such as with animal and clinical models, to see if these can constantly prevent common adverse pregnancy outcomes. And I'd hopefully like to do further work in this area the next step can be just doing more patients and seeing if any of these results are changed with more patients. Thank you for listening. Have a great day.